Well, with me right now is Dr. Badai from Pacific Pain and Regenerative Medicine. Good to see you again, sir.
Nice to see you again. Thank you. Thank you for having me.
Pain, let's talk about that. I think we all have bouts of temporary pain. We're talking about maybe in our joints, maybe we twisted our ankle.
Yeah.
But what you really do and your folks is take a look at people who have chronic pain, figure out what's going on, why, and how to alleviate that, right?
Absolutely. So, I mean, really, people come to my office not because of pain, but pain that gets in the way of their quality of life. So people are coming to my office and they are looking at things that they used to enjoy doing and are not able to do anymore. And I try to help them get back to their functional independence. And what we look at typically is pain. And what specifically I normally treat is neck pain, lower back pain, joint pain, and different kinds of musculoskeletal pain. So what I do is try to figure out from the point of the pain generator that is causing these symptoms. And so we try to go to the root of the problem and try to focus on how we can treat them interventionally. A lot of times people have pain that they need to see a specialist, and they think that, oh, it's a normal part of aging, when in fact we can treat that specific pain and get people to enjoy a round of golf or picking up their children, grandchildren, and things like that. So,
well, I think that one of the types of pains you hear about so often, that the chronic type pain, is lower back and along the spine, sciatica or whatever it might be.
Yeah.
And there are times that people go years of not getting any real relief, meaning they may be on pain medications or something, but not any real relief. So what are some of the things that you can do or you can look at to kind of pinpoint?
Yeah. I mean, we've come a long way from the way we manage chronic back pain. So what you're saying is disc pain that pinches a nerve, and that pain goes down the legs, sciatica that you described. Well, there's a lot of treatments that we do interventionally. Well, we first will focus on, trying to quiet that inflammation down by maybe adding a steroid, an epidural injection. If that doesn't work, maybe a nerve block, where maybe there's a pain generator in the joints of the spine. What I've tried to do in my office, be very innovative, and we actually are implementing stem cell therapy inside the joints of the spine and into the spine itself, the discs. We are treating a lot of patients with actually stem cells that come from the umbilical cord blood that we can actually implement and deliver under very guided X-ray imaging. So we do that. We're also implementing therapies such as neuromodulation, such as spinal cord stimulators, where we put electrical leads into the epidural space to control chronic inflammation. So we have a lot of innovative, forward-thinking type of treatment options in our practice.
What about the type of pain that comes from arthritis, or I guess other names are tendonitis, and all those itis, right? Bursitis, all those kinds of things. Of course, arthritis is something that's ongoing,
So that's a
and it moves around a lot of people.
It's a pandemic concern. It's an issue. Everyone deals with degenerative changes, and so once the degenerative process starts, it's hard to stop it or reverse it. We are controlling inflammation through different modalities, such as, like I said, the stem cell therapy, where we can actually control the inflammation and heal tissue and control the process, alongside with targeted physical therapy, and strengthening, and a lot of different kind of analgesics that I try to avoid opiates for as much as I can.
So exercise, how important is that? I guess it depends on the type of condition somebody has, but in general, I've even heard people that have a chronic arthritis who think, well, maybe I shouldn't be exercising, I should just sit and not aggravate, but it's really just the opposite of that, right?
It is quite the opposite. We've had a paradigm shift in our thought process in terms of how we manage pain from 100 years ago, where it was like bed rest, and we've learned quickly that muscle atrophy or disuse can cause weakness, and then what that would do is cause lack of support around the structure that's injured. So arthritis of a joint, what the goal is to take the pressure off of that joint. And so by strengthening the muscles around that joint, you're going to take the pressure off of that joint, which would then take the pressure off of those signals, those nerve fibers that are constantly being irritated. So very, very important is the stretching and strengthening. I tell all of my patients, I try to educate them every day about the importance of a daily stretching, strengthening, range of motion, home exercise program, just as if they were to brush their teeth twice a day. And so, that's how I tell them, like, I really want you guys to, when you go to bed, when you wake up in the morning, really focus on a program. Tai Chi is very helpful, or yoga done correctly under supervision is very helpful. Pilates, all of those are important for taking the pressure off of those painful pain generators. So that's what I do.
Well, it's, you have certainly heard over the years people who have certain kinds of back pain and they may be overweight. That part of the key is, well, if you lose some of that weight and start to do some exercise, there's a good chance that some of that pain, if not all, is going to go away because you're now strengthening your abdomen muscles.
Absolutely. So just to your point, I mean, you want to take the pressure off of the painful pain generator.
Yeah.
So adding a downward force will cause a little bit of worsening pain. So yes, lifestyle modification is very important. So dietary modification, calorie restrictions, but yes, controlling weight, increasing ambulation or walking, just to kind of increase blood flow, and blood flow will bring perfusion or oxygenation to the damaged tissue, and that's what we really do focus on in our office. So I think that patient education is a very important aspect of the way that we should practice pain management, but everything we do is not in isolation.
Right.
It's all multimodal. So this therapy, this therapy, this therapy, this type of therapy, this type of therapy. So whether it be the home exercises, whether it be injections, whether it be regenerative medicine, but there's a lot of treatment options that we can do in our office to take, to allow people to live a functional life as much as possible.
Now, one last question. Can they come directly to you? Do they have to go through their primary care provider? How does that work?
Great question. So I'm a Hoag affiliate, so I do take Medicare, and I do take PPO insurance, so they don't need to see a primary care doctor to see me. They can come directly to my office, call my office, or go online. I will be implementing telemedicine very soon to have that as an access point for patients who are not able to come to my office directly, but that we are rolling that out in our office very soon, just to try to be very innovative and provide hope and optimism and choices to be very comprehensive in their pain management.
Very good. Doctor, always good to see you.
Yeah, thank
Take
you.
care. We'll see you soon.
Absolutely.
All right,
thank you for
bye-bye.
having me.
We'll be right back.
Don't let spine